Okay. Yeah, 2 minutes. I go back to, look, the biggest problem with Romneycare, the biggest problem with Obamacare is it didn't solve the problem. It created a bigger problem. Because the problem in healthcare is we spend in America 17% of our GDP on healthcare. The next highest country is Norway at 12. Okay? And the bottom line is we have a cost problem in healthcare. And what Romneycare solved and what Obamacare solved was an access problem. And the funny thing about Massachusetts is there wasn't an access problem. 94% of people in Massachusetts had health care before Romneycare. I think they had the highest rate of insured in the country. And yet he passed a program, this huge government program, to cover 4% more. They're up to 98. And they brought this enormous, big government bureaucracy to do relatively nothing when it comes to that. And what we've seen is hospitals, still uncompensated care is higher now than it was when they were at 94% insured. Why? Why? Because everybody thinks they have access to all the health care that they want. The problem of health care in America is you don't pay for it. And unless we change that dynamic, again, remember I talked about education, responsibility? The biggest reason we spend more money in health care than any place else is because nobody understands healthcare, and nobody understands the consumption of medical care. Why? Because unless you are uninsured, you are not a consumer of healthcare. You are a user of healthcare, and someone else pays the bill, or you pay a fraction of what the cost of that bill is. And as a result, what happens? We overutilize. We spend more and we use more because we are disconnected from the cost of what we're consuming. And particularly it comes to is chronic illnesses, end-of-life care. If you have unlimited resources, then the answer is, well, sure, Dad, go ahead. It's covered. Maybe Dad can live a few more days, right? It's covered. It's not my cost. Instead of saying, well, you know what, this is a lot of money. Dad, has lived a good life. And I mean, these are decisions that we have to make every day, which is how we're going to allocate our resources. All right? And I've gone through it with my own father, and I know many of you have gone through a similar situation, but it can't be a situation where you don't consider what the cost associated with the care that's provided. Whether it's end of life, whether it's wellness care, all of these things. I mean, one of the things we don't allow insurance companies to do very much, they do some underwriting, but allow them to underwrite for health status, not just health status from the standpoint that you have. I mean, we have a disabled child. She is underwritten for health status. She should be. She's a very high-cost consumer of health care, unfortunately. But that's because she was born that way. A lot of people aren't born that way. They end up because of their own behavior. There should be some cost to the behavior. And all this community rating, all of this is all an attempt to basically say we're going to disconnect healthcare from your actions and from your wallet. And then we say, gee, why do we spend so much money on healthcare? So the answer is a bottom-up, again, going back to the whole basic principle, bottom-up healthcare system, people who are involved. Now, there are people who are disabled, there are people who are from no fault of their own, there are people who have chronic illnesses through no fault of their own. Look, we need to have some sort of community, some sort of insurance pools. There's some cost of health insurance that should be pooled, that should be communal, if you will, to take care of those on the margins of life. I know there's some libertarian types who don't believe in any of that. I do. I think when it comes to those who are on the margins of society, we need to have some sort of responsibility, whether it's through the private sector or through the government. We can negotiate that. But there has to be some sort of help for those in need in our society. But the bottom line is, you have to be more responsible. So it's a fundamental change in the way we consume healthcare. And I've been talking about this for 20 years. I introduced the first health savings account bill, which is a consumer-driven healthcare approach, 20 years ago with the governor of Ohio now. John Kasich was in the House, I was in the House. So I have been battling this battle for a long, long time, and I'm not going to change when I get to Washington. In fact, that's what I did when I was in Washington, and I will continue to fight those battles. And if you want to talk about, I always say one of the jobs of the president is being educator-in-chief. And you want to talk about a job that needs to be done to bring the American public and educate them, this is a big job. And you have to have someone who's got this core conviction and can go out there and communicate this message. I think a lot of consumers will get it, but it's going to be hard for a lot of people to make this transition. That we have to take more responsibility. We have to deal with more freedom. But that's the way we have to talk about it. We have to talk about it in terms of, are you the live free or die state or not? Okay? Because if you're not the live free or die state, I mean, if it's live secure and die state, then you know, hopefully New Hampshire can speak for freedom in this primary election, because that's what we're all about.